Good morning, everybody. This is Dr Pradeep Srinivasan from Fortis Hospital, Bangalore. Today I bring to you a very interesting teaching topic. The teaching for today is on heterotaxy syndromes or isomerisms in fetuses. It becomes very interesting because these syndromes involve the abdominal viscera, the cardiac structures, the lungs, the tracheobronchial tree, and the vasculature. First, I will show to you what is normal anatomy in a normal fetus with respect to certain viscera and vessels and cardiac structures which can go wrong in heterotaxy syndromes. So, these are line diagrams, colored line diagrams which depict the normal anatomy. So, here we have the tracheobronchial tree with the trachea, right main bronchus and left main bronchus. You can see these red dots. This is the left pulmonary artery, that's the right pulmonary artery. So, in a normal anatomy, the left pulmonary artery is above the left main bronchus and hence it is called as a hyparterial bronchus. Also, you can see that the right main bronchus has two divisions initially. The left main bronchus continues as a single long bronchus and then divides. When we come to the lungs, the right lung has 3 lobes, the left lung has 2 lobes. In the cardia, especially in relation to the atria, the right atrial appendage is broad-based, large, and the left atrial appendage is narrow, finger-like. The liver below the diaphragm is on the right side, the spleen is on the left side, the stomach is on the left side, the jejunal loops on the left upper abdomen and ileal loops are on the left lower abdomen. In the retroperitoneum, the aorta is a left-sided posterior structure, the IVC is a right-sided anterior structure. So, this we all know is the normal anatomy in a normal fetus. Now, I am going to remove this group of drawings or pictures aside and then we will bring in the abnormal ones. So, first I am going to deal with a condition called as left isomerism. Okay. So, I put the heading here. So, that is left isomerism. So, now under left isomerism, the tracheobronchial tree is different from normal. So, here I bring the tracheobronchial tree. So, as compared to the normal anatomy, in the tracheobronchial tree, in left isomerism, there is bilateral left-sidedness, and that means both the main bronchi. So, there it comes. So, here you see that both the bronchi are resembling the left main bronchus. You can see that there is no early division and both the pulmonary arteries are above the bronchus. That is, the arterial anatomy is eparterial or the the bronchial anatomy is hyparterial in both the sides. Next we come to the lung. So, the right lung is bilobed and shows 2 lobes instead of the 3-lobed anatomy. So, that will be the right lung. And the left lung also will show 2 lobes. So, that is the left lung. I am sorry, I will get the left lung for you. So, here we have bilateral left-sided type of lungs. That is the left lung. Okay. So, we have both the lungs with 2 lobes in left isomerism. Then I will show you what happens to the atria. So in the atria, we have both the atrium resembling left atrium. So that is, both the right and left atria will look like the left atrium, which is finger like, and I am going to bring the picture of bilateral left sidedness. One second. So here we have the cardiac anatomy with both the atria finger like and symmetric. So we have bilateral left atrial appendages. Then we come to the cardiac anatomy. So the cardiac anatomy is also varied, and you can see that isomerisms are predisposed for multiple intra and extracardiac abnormalities. I am going to bring the heart down now. So that is the cardia. Now in left atrial isomerism, there will be an interruption of the IVC. Once the IVC is interrupted, then the azygous vein takes over the drainage, and we have azygous continuation of IVC. You can see here, that is the azygous continuation of IVC, which will go above and drain into the SVC. Within the heart, in left isomerism, there will be conduction abnormalities, and we can have the sinus node being abnormal, which may result, or usually which will result in conduction abnormalities, heart blocks and premature IUDs in relation to heart blocks. Also in left atrial isomerisms, we can have atrioventricular canal defects, double outlet right ventricles, and various other complex cardiac abnormalities. We will now come into the abdomen. The liver, instead of being right sided, will actually be in the center. So I am going to bring the liver now. So that is the picture of the liver. Now the liver would be central, and that is the stomach. The stomach would also be central. Now that is the abdominal visceral abnormality. Now, in left isomerism, since there is duplication of the left side, there will be polysplenia. So here I have polysplenia instead of a single spleen. Detection of polysplenia may be tough by ultrasound. So I will bring the polysplenia picture now. In the fetal anatomy, polysplenia may be tough to detect. So here we have on the left side multiple small spleens. Then in the abdomen, usually there is malrotation, and the jejunal loops, like the stomach, would be central, and they are predisposed for malrotation. So that is the abdominal viscera with malrotation. And finally, aorta IVC has also an abnormality. Normally the aorta is left sided, IVC is right sided. Here you can see that in isomerism or left isomerism, the aorta is in its normal location, and instead of the IVC being on the right side, The venous return is by azygous vein, which is on the left side of the aorta, and both the vessels are having a side by side predisposition. So this is called as a double vessel sign. So to summarize, in left isomerism, we have both tracheobronchial tree having the left sided anatomy, that is, both the bronchi are hyparterial, both the right and left lung are bilobed, both the atrial appendages of the cardia are having a left atrial appendage morphology. There is interruption of IVC and there is azygous continuation of the venous return which flows into the SVC. Within the heart there can be complex cardiac anomalies like DORV, atrioventricular canal defect, etc. And usually the sinoatrial node will be dysfunct and this will result in heart blocks. In the abdomen there will be central liver, central stomach and jejunal or small bowel malrotation, and in the retroperitoneum we will have absent IVC and a azygous vein lying side by side to the left of the aorta called as the double vessel sign. So that is left atrial isomerism. If you have understood left atrial isomerism as compared to normal anatomy, I will shift it out and then we will look at right isomerism. Okay. Now I am going to deal with right isomerism. So I will get the topic first up. So now we have right isomerism. In right isomerism, the tracheobronchial tree in right isomerism, we will have the following findings. First, tracheobronchial tree. Both the sides, the tracheobronchial tree will look like right-sided division. You can see that both the bronchi have divided early, and you can see that both the pulmonary arteries are below the bronchi, or the bronchial anatomy is eparterial bilaterally. When we come to the lungs, you can see that the right lung has 3 lobes and the left lung also has 3 lobes. So both the lungs have a 3-lobed right-sided anatomy. When we come to the cardia, especially in relation to the atrium, you can see that both atrial appendages are like the right-sided with broad base and rounded morphology. In the cardia, in right isomerism, usually there is a left superior vena cava and intracardiac abnormalities are more severe in right atrial isomerism. There can be atrioventricular defects, double outlet right ventricle, total anomalous pulmonary venous drainage, etc. and many other abnormalities can be there in the cardia. Below the diaphragm, we have the central liver, central stomach and malrotation with midline, jejunal and ileal loops. When we come to the IVC aorta relationship, there is a directly anterior disposition of the IVC in comparison to the aorta, and this is called as piggy banking of the IVC over the aorta. So to summarize, in right isomerism, there are bilateral right-sided bronchial anatomy, bilateral eparterial bronchi, bilateral trilobed lungs, bilateral right-side broad-based ear-like atria, left superior vena cava, complex cardiac anomaly which could be atrioventricular septal defects, double outlet right ventricles, TAPVCs, etc., central liver, central stomach, small bowel malrotation, and anteriorly placed IVC as compared to aorta. So, today we have dealt with normal anatomy of lungs, tracheobronchial tree, cardia, liver, stomach, small bowel, aorta IVC, and what happens when alterations in these are in certain patterns which result in either left-sidedness or right-sidedness as dominance. So, in left-sidedness we have left isomerism as a abnormality, and in right-sidedness we have right isomerism as an abnormality. As far as these theoretical changes are concerned, it may look easy, but the clues in fetal sonography will emerge in the abdomen when you start seeing that there is situs inversus or situs ambiguus. So, the liver and stomach position is what gives us the first clue. The second clue will come with the aorta IVC relationship alteration. Either you could find a missing IVC or you could find an IVC to the left of the aorta, which actually would be an azygous. Jejunal malrotation may be difficult to diagnose in the fetus. Cardiac abnormalities would look very grotesque, and if there is a heart block, conduction abnormality, then we think of left isomerism. If there are very serious cardiac anomalies, then we may be dealing with right isomerism, especially with an LSVC. The clue to this classification will come when we look at the atrial morphology, and if we find both atria having finger-like appendages, it is left isomerism, and when we find both atria having broad-based big atrial appendages, then we may be dealing with right isomerism. It is difficult to look at the number of lobes of the lung and to look at the tracheobronchial anatomy or the relationship of the pulmonary artery with the bronchus in the fetus. This is Dr. Pradeep Srinivasan, who has tried to simplify heterotaxy syndromes with the help of simple line diagrams. For more learning about isomerisms and various complex cardiac abnormalities, I request all of you to Google refer.mediknit.org, that is refer.mediknit.org. Once you enter the website of Medinit, then you can look at Refer, which is Radiology Education for Enhancement of Radiologists. So, Refer series is done by me, and at present we have 2 certificate courses, one on fetal echo and one on aneuploidy. These courses have long hours of narration with the use of models, line diagrams, and various other props, cines, etc. When it comes to aneuploidy, we have even recorded a live mock counseling show, and I have taken various scenarios of aneuploidy combinations and taught how to calculate risk assessment in the second trimester. In both the courses, more than 50 worked up cases of aneuploidy and various cardiac anomalies have been discussed. Wherever applicable, autopsy specimens have been shown and karyotype evidence has been given. These courses are available for you for about 6 to 9 months to leisurely go through and learn. At the end of the courses, there are 100 questions which you need to answer, and if you clear a minimum 60 correctly, then you would be entitled for a certificate either in aneuploidy or in fetal echo. I thank all of you who have taken your time to look at this video on heterotaxy syndromes. For further learning, look at my courses under refer.mediknit.org. Happy learning. Jai Hind. Dr. Pradeep Srinivasan from Bangalore.